obesity is an epidemic in our country. And as an orthopedic surgeon, we know that many of the complications that we see, the risk is increased by obesity and by metabolic dysfunction. And so we have to do something. It's become a problem with trying to take care of people because more and more people are presenting with arthritis that has failed conservative treatment, and they need to manage not just their weight, but what's causing them to be overweight. And so when we started trying to manage this population of patients that's increasing, we were looking for a way to help do that. And it happens that enlisting the expertise with, in this case, Prescribe Fit, and also having a meaningful revenue stream from that is really a great combination for our practice, but most importantly for the patients. And so enlisting the expertise has allowed us to be a differentiator in our market because we're not telling people, hey, you're too heavy, go lose weight. We're saying, hey, you're too heavy, but we have something that we can offer you alongside you to help you. But I think offering them something that's meaningful and effective to benefit their lifestyle and lose weight and have better metabolic health and subsequently better mental health and all the things that go in with improving lifestyle, we're offering something that other practices in town are offering. And I think whether it's word on the street or whether we capture more people and they don't wander off because we just tell them to lose weight, I think it's great for the practice. Most importantly, it's great for the patients, but it's great for the practice as well. This is a people service. We're not plugging them into an app with some AI bot that's telling them, don't eat carbs. That we're partnering as a practice with someone that very professionally and very compassionately helps our patients that need help. So partnering alongside someone that can have that compassionate message, lifestyle change, long-term benefits, not just the surgery, is super critical when we talk about digital health platforms and particularly remote patient monitoring. Really, it boils down to three things, and that's accumulation of data, whatever communication you're using with the patient to nudge them, to feed them information for education, for it's time to do this, it's time to do that. And then what it actually does of monitoring. But as I mentioned earlier, this is also a very manpower intense process. Who's doing it? And do you have the manpower in a small practice to afford to give it the appropriate time? Do you have the expertise? Can you afford the expertise based on the compensation that you get from the RPM or from the therapeutics? And I think most folks aren't able to accomplish that. And so it becomes a burden to try to manage all of that information, all of that communication, the nudging, the monitoring, the alerts. In this case, the one that has really worked well for the goal of wellness and lifestyle is Prescribe Fit, is doing that work. I'm managing it. I'm getting the updates. I'm kind of the kingmaker of the chessboard, as it were, but the work's being done to benefit my patients on my behalf, under my direction, with a partner that is Prescribe Fit. If you've been in practice for even a few years, you've seen this significant increase in the percentage of patients that are overweight, obese, metabolic disorder, insulin resistance, et cetera. And we all know, every paper, those are risk factors for complications. We all want to be surgeons, we all want to operate, and we want to have good outcomes. Without trying to do something, this wave is coming, if it's not already here, in terms of obesity and metabolic disease. I think that this is the only real way to do it. Number one, from a compliance standpoint, understanding what you're supposed to do and what you're not supposed to do. And having an expert partner that can help navigate that without a huge lift on the part of the practice is really, really important in my opinion. And so having a partner like Prescribe Fit that knows what they're doing, that does it for a living, that can help with all of the things that create the lift, makes it a much easier lift.